Welcome everybody to the webcast series, The Public Health Insider. My name is Casey Farm and I am the Director of Alumni Relations for the College of Public Health and Human Sciences. I'm absolutely delighted to introduce today's moderator for today's episode, Isolate the Problem, How COVID-19 is Rapidly Deteriorating Social Connectedness and Exacerbating Health Disparities. This is the second webcast of the return of the Public Health Insider series. As a reminder, our third and final episode of this season will take place 2 weeks from today on Thursday, November 12th at 1 p.m. For more information and to register, please visit osualum.com/publichealthwebcasts. A couple of logistical items for today. If you look at the bottom of your screen, you will find a Q&A chat button. You are welcome to type questions at any point in time during today's talk, and at the end of the presentation, our panelists will answer as many as they can before the end of the episode. Our webcast series is hosted by the OSU Alumni Association in collaboration with the College of Public Health and Human Sciences and the OSU Center for Health Innovation. We are very excited about the return of this series surrounding public health, what it is, why it is important, and how it applies to our lives and our communities. For more information on public health and all the other incredible work going on in the college, please visit health.oregonstate.edu. Now, on to today's moderator, who will introduce today's topic and panelists. Our series moderator is Dr. Allison Myers, and she is the director of the OSU Center for Health Innovation in the college. Before coming to Oregon State in 2018, Dr. Myers served as the Health Policy Fellow to U.S. Senator Sheldon Whitehouse of Rhode Island. She also co-founded and led Counter Tools, which is a nonprofit technology startup dedicated to advancing place-based public health through citizen science, data visualization, and policy advocacy. She earned her Bachelor's of Science in Environmental Resource Management from Penn State University and her MPH and her PhD in Health Behavior from the Gillings School of Global Public Health at the University of North Carolina in Chapel Hill. It is my absolute pleasure to welcome back and introduce and turn the webcast over to Dr. Allison Myers. Dr. Myers, an absolute pleasure. Thanks for being back with us again today.
Thanks, Casey. That's such a lovely introduction. I lead the Center for Health Innovation at our college, and it's my job. I have the privilege of often being a connector between faculty at our college and community partners, broadly defined, whether they be from local public health authorities or community-based organizations or health systems or plans. I get to be a connecting point between our faculty, staff, and students and the folks with whom we are achieving the vision of our college, which is lifelong health and well-being for every individual, family, and community in Oregon and beyond. To that vision, I want to take a minute before we begin to simply acknowledge that the Corvallis campus of Oregon State University is located within the traditional homelands of the Marys River Band of Kalapuya. Following the Willamette Valley Treaty of 1855, Kalapuya people were removed from the lands in Corvallis to the reservations in Western Oregon. And today, living descendants of these people are part of the Confederated Tribes of Grand Ronde community of Oregon and the Confederated Tribes of the Siletz Indians. And as we think about, as a college and as a state, creating conditions for health and well-being for everyone, it's important to be reminded on the land in which we sit. With that, again, thank you all so much for being here today. I'll ask Jonathan and Nancy and Cynthia, our three panelists for the day, to go ahead and turn on your video and unmute yourselves. I can tell you how we're going to do this today. We're just going to start by having our guests introduce themselves, and then we've got 3 rounds of content. We'll lead you through all of that. And please, folks in the viewing audience, don't forget that there is a Q&A feature, and we would absolutely love to hear from you at any point. Go ahead and type in your questions. With that, let's get started. Let's have you introduce yourselves. I'm going to come to you first, Jonathan. Can you tell us who you are, what your affiliation is with Oregon State, and how you got interested in today's topic of health disparities and social isolation?
Thank you so much, Allison. And I really appreciate this opportunity to share our work. We're really passionate about our work, and I hope that everyone enjoys it as much as we do. I'm an assistant professor in global health in the College of Public Health and Human Sciences. I'm also the program director of the Global Health Program. And currently I'm the program director of the ENLACE program, the Engaging the Next Latinx Allies for Change and Equity, which is the project that led us to this important work. And really, I became interested in this work as I grew up as a Latinx immigrant. I came to the United States when I was 5 years old, and my grandmother was the one who petitioned us, and she made arepas, so those thick corn patties, selling them to be able to save enough money to petition us. The other aspect of my identity that's really important for this work is that I'm gay, and I came out when I was 13. And so when I was 13 years old, my grandmother and my mom found us an alternative or independent Catholic church that welcomed LGBT people. And so it was really good for me, and I was very happy to be supported, and I had a lot of wonderful opportunities because of this. I went to great colleges and got a great education, but not that many kids are actually that fortunate. And so for us, it's really important to use those opportunities to help others and really to draw on our own experiences with social isolation, marginalization, to help others and use those as our greatest tools. So that's sort of what drives me in this work.
Thank you so much, Jonathan, for bringing your whole self to our webcast and to your work. I love it. Nancy, can you introduce yourself? And same question, how did you become passionate about work in health disparities and social isolation?
So hi, I just wanted to start by saying thank you for everybody for coming. I recognize lots of the names in the chat. So my name is Nancy Vargas. My pronouns are she, her, hers, and I'm the program coordinator for ENLACE. I'm actually originally from California, but moved here for school. And I'm currently a 5th-year doctoral student here at OSU studying public health with a focus on Latinx health, particularly youth health. I'm also currently one of the lead negotiators for a graduate employee union regarding pandemic-related negotiations to ensure we have the resources to perform our job safely. In my spare time, the time that I do have, I volunteer for 4-H outreach, and I've been doing that for over 4 years. And I have probably around 1,500 plus volunteer hours working for them. I think I used to track it, and I just don't track it anymore. It's just impossible. And then after working with this youth, I became really passionate about this population that mainly come from immigrant backgrounds. And I knew I really wanted to do research with these youth. So coming on board to this project just seemed like the perfect fit, since I know the community we would be working with, and I can relate to a lot of their experiences. My family themselves have experienced a lot of marginalization from society at large throughout my life. My parents are actually from extremely rural areas in Mexico. My mom is from a town of 500 people, and my dad's hometown is population 30, which is like super tiny. And growing up, I grew up in extreme poverty. In fact, I'm actually the first person in my family to make it past elementary school. So, first one to graduate from middle school, first one to graduate from high school, first one to get a BA, first one to get a master's, and hopefully soon enough, first one in my family to get a PhD. And despite all these obstacles, I'm here, and many people always praise me by saying how resilient I am, how people like me need to be studied to see what about our personalities or identities allow us to succeed. However, as we discuss, as we have this talk, I really want the audience to reframe these thoughts. I want people to ask themselves, what are the higher level systems that prevent people from achieving their full potential? How can we come together to create these healthy environments? And I'm just really super excited about today, and I look forward to your questions and integrating little pieces of me throughout this talk. So you'll also hear about what we found, but also how I relate it to what I've experienced.
I love it. I'm so glad that we can feature you as one of our advanced doctoral students as well. You bring such a wealth of experience, and I think it's important for viewers to know not just what our faculty are doing and who they are, but who our doctoral students are as well. Thank you so much, Nancy. And let's turn it over to Cynthia. Tell us about you and your affiliation with Oregon State and how you got interested in the topic.
Yes, thank you. Hello, everyone. I'm super excited to be here and also nervous, so bear with me. My name is Cynthia de la Torre. I use she, her, ella pronouns. I've been working with the Enlace program as a community advisory board member and also as a research collaborator. So this is a solidarity-based approach in addressing social isolation among Latinx LGBTQ plus youth in the 4-H program and hopefully beyond. I'm officially part of the OSU Alumni Association as I recently graduated from Oregon State University. Go Beavs! During my time at Oregon State University as part of the Centro Cultural Chavez, the wellness agents, I have my cup here with me, and also the multicultural Greek organization Kappa Delta Chi Sorority Incorporated. And I also volunteered for the 4-H Youth Outreach Programming. And addressing health disparities for me is every day, I think. And I think this work involves all of us as these inherently pervasive systems. We also have to imagine a world, a more just world without them. And this starts with each other. We're all interconnected in our daily lives, as I mentioned. So intervening and preventing harm, both intentional and unintentional harm, especially teaching that to our youth is very crucial to imagine a more just future.
Thank you so much, Cynthia. Again, what a pleasure. You'd think we planned it to have a faculty member, doctoral student, and a recent alum. It came together that way. We're so grateful that you all are here. Totally okay to be nervous. You show up anyway. And with that, I think let's go ahead and get started. I think, Jonathan, you're up for sharing your slides, and I'll hide myself and jump in if I really need to.
Wonderful. So before we begin, I really want to acknowledge the community members who participated and played a key role in our program and co-creating this program, as well as the institutional partners that worked with us. So Outside the Frame, which is an NGO in Portland, Oregon, that amplifies the voices of marginalized youth, the Brazilian Interdisciplinary AIDS Association in Rio de Janeiro, and OSU Extension and the 4-H program, which have been vital partners, especially Mario Magana. We also want to thank the Robert Wood Johnson Foundation for funding the Enlace program. In this talk, you'll hear from Nancy, Cynthia, and myself. All of us have been integral to developing Enlace. As the program director for Enlace, I'll be covering the first couple of objectives. I'll briefly describe the problem of social isolation among Latinx and LGBTQ communities. And then I will introduce the Engaging the Next Latinx Allies for Change and Equity program. And then Nancy, the program coordinator for Enlace, will identify how COVID-19 has worsened isolation and health disparities, and talk about really the importance of this work and contextual factors for shaping social isolation among LGBTQ youth. And then last, Cynthia will identify some resources in Oregon for the Latinx families. And Cynthia, of course, is our 4-H alum. She is an OSU alum, and she's an integral part of the Enlace project as well. So in this slide, you'll see a lot of words, but I'll point you to specific areas. This was developed for our global evidence mapping published in Global Public Health. The first thing that I want to highlight is the fact that there are a range of contexts where social isolation among LGBTQ youth can be addressed. Social isolation, as Nancy has already pointed out, is a problem with social context and not with the individual. So effective interventions to reduce social isolation and its consequences must include changes to the social context, culture, policies, and institutions. This diagram also shows the main individual level outcomes of social isolation, which include depression, self-harm, suicidal ideation and attempts, and sexual risk-taking. and as well as differential access to mental and physical health services. And in fact, studies have found that youth who have been highly rejected by their families are 8.4 times more likely to attempt suicide as adults. So we're addressing intersectional social isolation, and this really represents the combined marginalization and isolation that results from being Latinx and LGBTQ and a New American and so forth. Families, religious organizations, and cultural enclaves are key resources of social support, and these can be protective for youth against the consequences of racism, xenophobia, especially in a predominantly white state like Oregon. Latinx youth often fear disclosing their LGBTQ identities to avoid disrespecting the family. The family is a major source of support, but they can also be a major source of potential conflict for LGBTQ youth. LGBTQ youth, as a result, could lose access to essential material resources such as housing security, and as a consequence of being rejected by their families, could experience heightened social isolation. According to the Oregon Healthy Teen Survey in 2019, among non-binary and gender non-conforming 11th graders in Oregon, 54.2% reported feeling sad or hopeless in the last 2 weeks. 37.2% seriously considered suicide in the last year. 13.8% actually attempted suicide in the last year. And 40.6% felt their mental health professional, counselor, or social worker did not meet their needs, their emotional and mental health needs. So this is a grave situation. And layer on top of that, remember we're talking about intersectional social isolation, the health disparities created by COVID-19, which has disproportionately affected Latinx people in Oregon. You see here that in Oregon, Latinx people represent 13.4% of the population. However, they represent an overwhelming disproportionate amount of COVID cases at 37.2% as of October 21st. So we developed the Enlace program, again, which stands for Engaging the Next Latinx Allies for Change and Equity, to address social isolation among youth participating in the 4-H leadership institutes. We worked with community stakeholders to transform this social context, and our goal was to generate empathy and solidarity with youth who are marginalized because of their ethnicity, place of residence, history of migration, socioeconomic status, as well as their sexuality, gender identity, and expression. In this first phase, we convened 45 community stakeholders, including Latinx LGBTQ youth, 4-H youth, Latinx parents, health providers, to develop the themes of the telenovela. That's right, telenovela, or a soap opera inspired intervention. The 5 themes were: 1, building solidarity based on mutual identification on experiences of marginalization; 2, navigating social institutions like the family, religious organizations, schools, 4-H; 3, dealing with bullies; 4, meanings of citizenship and community participation; and 5, accessing health and social services. And these themes inspired Latinx LGBTQ+ youth to co-create 5 telenovela videos based on their lived experience with social isolation that will be used in our intervention toolkit. This is a picture of one of the filmings of one of the telenovela inspired videos about bullying in school. And this slide says a lot. We'll summarize it for you. It's basically the themes, some of the themes that emerged from our focus groups with these stakeholders. At the individual level, LGBTQ and 4-H youth participants believe that attributes like being too dark, if you are ugly, not having social class, and not knowing English cause social isolation. Several participants elaborated on how passing as white, straight, or as a cisgender woman was a privilege. Most LGBTQ youth experience identity strain that left them feeling alone and quote, feeling like you're not worthy because you don't look in a certain way, and lacking someone in whom to confide these feelings. Interpersonal factors included rejection from families, communities, and even from their own LGBTQ communities and peers. Parents acknowledge this by claiming that sometimes, quote, as parents, we make them insecure and feel they are worthless. At the level of community and cultural representations, some suggested, quote, breaking expectations and representations in the media to show stories that subvert stereotypes or shift them from general to specific, and to debunk myths that Latinx communities have about LGBTQ identities. At the institutional level, participants identified migration, housing, and employment policies and laws as sources of social isolation. For example, undocumented status generates the fear of applying for the Oregon Health Plan. Similarly, there was a lack of access for gender-affirming healthcare and peer-led case navigation to reduce fear of accessing services due to immigration and gender identity. In schools, they perceived a lack of school curriculum on LGBTQ history and a lack of an inclusive sexual health curriculum. And here is our wonderful Cynthia as one of our champions. In this picture, you'll see Cecilia and Cynthia, who are parent and 4-H alum champions. The greatest challenge in this project was to bridge understandings of relationships between Latinx communities, which sometimes have traditional religious values that are contrary to LGBTQ inclusivity on one hand, and LGBTQ Latinx youth who have experienced social isolation, so they may be afraid of other parts of their community. For this reason, we worked with champions as spokespersons to generate community buy-in and to recruit parent-child dyads for our workshops. This third picture here is of our premiere at the Outside the Frame Gala before an audience of 400 people. This was obviously before COVID had hit. This was in November of 19. In the current stage of our work, the second phase, we're amplifying community voices in film screenings, conferences, podcasts, and 4-H workshops. We are interviewing parent-child dyads about their experiences with social isolation during the COVID-19 pandemic, and we are adapting our workshops to an online format. Next, we will pilot our virtual intervention to examine its feasibility on the effects of participants' self-reported social isolation and self-efficacy as LGBTQ allies. And the biggest implication for our work currently is that we need to reframe the problem of social isolation. Current models place the responsibility for social isolation on the individual, suggesting that isolation is a consequence of their identity, of being a certain way, or of having a timid personality. We need to reframe this. The individual is not at fault. The social context and the system is the problem. We emphasize that isolation is a result of systemic oppression that plays out in interpersonal relationship, in cultural systems and representations, in institutional policies and practices. And to tell us a little bit more about how COVID-19 has exacerbated some of these issues, we will hear from Nancy.
All right, hi everybody. I was also that person in that picture. I got to be in a telenovela. It was very fun. So now we're gonna move on to some of the data we collected in terms of adapting this intervention. 4-H youth, 4-H Latinx parents, and 4-H staff collaboratively came together to adapt the program, as Dr. Garcia mentioned. We added coronavirus questions to the parent interviews conducted as part of registering youth for our pilot program to see how communities are coping with the pandemic. We included questions about social demographics, social determinants of health, such as housing, education, work, access to health services, and how they're coping with social isolation, topics on LGBTQ plus issues, and ways in which COVID-19 affected health disparities and social isolation as well. We also held a meeting with 4-H Youth Community Advisory Board members to capture the youth experience. So far, we have interviewed parents of 23 Latinx youth in grades 9 through 12. Hearing their stories was super impactful for myself Interviews revealed increased social isolation and a lack of resources as a result of COVID-19 and the political climate here in the United States. I will share some selected quotes from our first theme, which is housing and food. I really connected with what this mother with 8 children said about her living and financial situation. She said, "I always talk to my kids about how we would make do. We would find a way to get food. We are 10 in our family. The manager told us we needed to move because there are too many people in our place. The ratio is too high. We might move to a house, but it's hard right now. I think they won't kick us out right now." I want to connect this quote with my personal experiences. I myself lived with 17 other people in a tiny 2-bedroom, 1-bathroom apartment. I personally know what this experience is like pre-pandemic and the constant worry one has to face every day, whether you might get evicted for quote unquote breaking the rules. What options do people have? What policies create housing instability? Another mother I connected to shared the following. We continue to seek resources, especially at the end of the month. They only eat cereal with milk. We make small meals when we can. The tone in the voice of this mother was heartbreaking. The free school meal site was more than 30 minutes driving distance, and they didn't have a viable transportation. There was no way to walk there. No churches with food pantries close by either. Despite the struggle she was having in feeding her family, she helped other migrant families stay involved and connected in their children's education through getting parents involved in the PTA. Her story is one of many that highlight how key community leaders and resources are also struggling with housing and food. Not only have families been affected in the areas of housing and food, they have been affected in the areas of work. This mother that works at a winery stated, "The place I work is based on sales and events. There was weddings and corporate events. The way in which we related to each other changed. We were friendly and now we keep our distance. They ended up firing people, and the people that stayed were able to work. They let go of a lot of employees, 20 people. Only 10 of us remained." This was a very common experience for many families. Sometimes both parents lost their jobs or lost hours. It's even harder when parents hold multiple jobs to just stay afloat. I know from my experience, my father growing up had 4 jobs at once and worked 90-plus-hour work weeks. Unfortunately, he is not unique. People don't work that many hours for low pay because they want to. They do it so they can live, to obtain basic needs such as food and housing. I also wanted to add that the corona pandemic really highlighted the lack of health and safety plans in workplaces, as demonstrated by the outbreaks at farms, canneries, and factories, a lot of these places that Latinx people work at. Another theme that emerged was education. As I was conducting the telephone interviews, I was asking parents if their kids had an IEP, and that stands for Individualized Education Plan. These plans help support kids with additional resources to overcome learning obstacles due to learning disabilities. And this is something that I particularly am fond of, as I receive disability access services through OSU, and something that has helped me and supported me in my own learning. So after describing what it was, this one mother realized her daughter had these type of supports when she was a migrant farm worker in California, but not in Oregon. So these supports did not transfer over. She stated, "We need this IEP. Our second child has ADHD, and they told us there was no such program. We will be seeking these resources." To me, this really highlights the lack of access people have to these resources. At least one other parent shared their child had these supports before the pandemic, but did not realize a new IEP needed to be adapted to online modalities. How many children with disabilities are being left behind by the school systems? Many families stated that they had to share computers or tablets, lacked high-speed internet to connect to live class sessions, and that children felt they lacked the social connectedness they would have if they were in school. I know for me and some of my students, everyone wants to feel connected to something or someone. It helps us get through the day. That connection helps us cope and provide hope. When we asked youth to explore this question, they stated, I'm thinking about coping habits, how LGBTQ youth are responding to social isolation, like thoughts, anxiety, and depression, not having a routine. Who has access to coping, especially? Every day is a hard day. I don't have enough time. I feel pressure to be productive. I have to be productive. My energy is down. The pandemic has helped finding my introverted side, but it's draining. I'm trying to keep up with people around me driving me to be productive. It feels like I'm not enough if I'm not productive, but it feels lonely. So right now, all youth have unreasonable expectations to be productive, and that is affecting their self-esteem, and many lack access to resources to cope with their perception of a shrinking world. Despite all this, youth are worrying about others. Latinx youth clearly connected their isolation to the isolation that LGBTQ people experience. Another theme we had was healthcare. So there was this mother with 2 kids that shared her experience pre-COVID. She highlighted the discrimination experienced in a healthcare setting. She said, "We went to the hospital. When the doctor received us, she didn't talk to us. We had an interpreter, but the doctor was distant and cold, didn't talk to us directly. I complained because it wasn't the first time. They fired the interpreter because she defended us. We had to start from zero. I'm tired of them treating us that way." This directly connects to the experiences during the pandemic. A mother shared that she was sick with COVID back in, I believe it was end of March, early April. And she was actually one of the first few cases. And she stated the doctor was not good. She did not want to believe we had coronavirus. We were the first cases in Oregon. No isolation, no rules, nothing. As you can see, there is a pattern of providers mistreating Latinx people by denying them resources or by not believing they can suffer from an illness. Pretty much taking their rights away, not recognizing them as human beings that go through the same emotions and pain. I want to recognize that this is not about one bad individual or one bad provider, but a healthcare system that allows this type of behavior to occur. I want you to think about this mother who was not believed, not tested, not told to isolate. She was out there walking in our community. Not only did this instance of discrimination affect the Latinx community, this affected each and every one of us. It caused our corona exposure to increase. Discrimination doesn't hurt a select few, it hurts all of us. Many of the parent stakeholders requested financial resources and referrals to community-based organizations. However, there's a fear to use these resources and to become a public charge, or for fear of becoming a public charge. Under this public charge policy, you can't apply for legal residency or future citizenship. One mother shared, "We came to work and contribute to the economy. You always feel excluded. In our minds, we don't feel like we're part of the USA. Then they tell us to use their services, but I'm afraid to use them. I'm scared to become a public charge." As you can see, the fear they experience in becoming a public charge placed them in situations we discussed in which some only had cereal to eat and others were on the brink of losing their housing. As you can see, these inequities in access to social determinants of health, such as housing, work, and education, were further worsened by the pandemic. The lack of access to these resources in Latinx communities worsens all types of health outcomes, including physical and mental health outcomes. We need to eliminate these barriers to access to ensure healthy and thriving communities. I know many of you at this point might be asking yourself, how can I help? How can I be an ally to both of these communities? But before we get there, I want to explore the meaning of allyship. Before the COVID pandemic, we were working on the definition on allyship in the Latinx community to facilitate the ways people can connect their experiences to LGBTQ experiences and take action. We call this mutual identification. The meanings of allyship to address social isolation range or were on a spectrum. So they range from tolerance to compassion to one based on solidarity and mutual identification and becoming co-conspirators. One parent shared, "We as parents are the main educators and the main lessons are love and respect. I don't think we need a degree to teach our kids. Compassion is what is really needed in these times." Parents' perspective of allyship was grounded in core values that resonated with their religious perspectives, particularly Catholic perspectives in these instances, including love, respect, and compassion, and the golden rule. There was another parent who shared, our children suffer so much because of their lack of identity. One of my daughters told me, look, I don't feel like I'm Mexican and I'm not American. I was not ready for that and did not know how to respond. So I asked, why do you feel this way? She said, I know that I'm Mexican because you and dad are Mexicans, but I was born in Mexico. I was not raised in Mexico and I don't know anything about Mexico. I'm not American because I'm in the middle of all the white people and I'm not like them. God, illuminate me and help me because kids suffer and they keep many things in silence. That's how LGBTQ people suffer rejection since their childhood, traumas from different situations. For the gay kid, it's triple. It's like seeing him as abnormal. As you can see, there is a pattern of parents and youth connecting social isolation they experience with the isolation that LGBTQ people experience. So now we're going to move on to allyship based on solidarity. So one thing we want to do is expand the definition of allyship beyond compassion and beyond tolerance. As this LGBTQ Latinx youth who works as an outreach worker explains, she is looking for co-conspirators, people willing to lose it all to be on the side with her. A 4-H alumni stated that white supremacy and other oppressive systems are underlying sources of social isolation for both LGBTQ and Latinx people of color. They recognize the need for all of us to examine how we maintain the status quo and how we as Latinx people can also perpetuate white supremacy, how each one of us needs to examine our allyship. This excerpt from co-author in this presentation, Cynthia de la Torre, she states, stereotypes are perpetuated by people in power and people who benefit from these stories, often even Latinx people too. It deliberately erases people's unique lived experiences, but more so Black Latinx, Afro-Latinx, Afro-Mexican, Afro-Indigenous, and Indigenous people of Latin America. Their experiences are often unique to Latinidad. In Oregon, there is Mexican centrism and Mexican American centrism. The stereotyping of Mexicans is often around festivities, sombrero, Cinco de Mayo, food, beans, tacos, and burritos, language, specifically broken English or Spanish or Spanglish, and socioeconomic status stereotypes, legal status, low education, occupation, etc. While words are only just words, it is important to understand that carrying these narratives weaponizes them into policies and biases which harm, demean, and are lethal as to who is deserving of human dignity. At the 4-H summer camps, there is a hesitancy to discuss how Latinx youth can perpetuate racism. I know one youth came up to me and said, but I don't get it. And also, why is this relevant or necessary? Racism doesn't hurt me. This youth was not only white passing, but also identified, most likely still identifies as a cisgender, heterosexual, young Latinx man. We had Indigenous youth from Oaxaca, Mexico, whose Spanish was their second language and they were learning English. We had immigrant Black Colombian youth who had recently immigrated to Salem, Oregon, and who didn't speak English to the level they felt comfortable with. While everyone was pretty welcoming, there were definitely moments that I witnessed othering and tried to find ways to talk about it, but it was challenging. The dominant group was definitely migrant Mexican American youth. How do we unpack that? How do we bring in stories? How do we talk about power and privilege? How do we help bring privilege as a responsibility to reflect, to give space, to speak up if needed? In light of what is a big conversation around police brutality and the Black Lives Matter movement, Latinx people are not exempt from these topics. We need to talk about the anti-Blackness and the contributions and the deep roots of Africa and Latin America. The story of who we are involves all of us. Colonization and slavery still impact our lives, past and present. So that was a lot, I think, for everybody to unpack. And again, the author was Cynthia of that piece. All of us, I think, need to continually reflect on what we can do better for all marginalized communities in order to be better allies. In terms of next steps, will we be piloting a peer-based intervention to address social isolation among LGBTQ youth soon in an online modality, as Dr. Garcia stated? In the COVID data collected thus far, we see a lot of connections between the social isolation experience and the LGBTQ plus social isolation experience. And so we're going to incorporate that in our intervention. This mutual identification can further drive people towards action and fighting for what is right for others. The intervention developed will push for mutual identification and a solidarity-based approach to allyship. Hopefully everybody here today recognizes the root causes of social isolation experienced on a regular basis by marginalized communities, and I encourage you to advocate for greater access and equity to social determinants of health. And most of all, to remember how oppressive systems do not just affect one individual, it affects each and every one of us. If we protect those most vulnerable, we protect ourselves. Which is why I also really highlight that wearing your mask, super important. We're protecting the most vulnerable populations. In this case, I wear a mask to protect the Latino community. And now we're gonna have Cynthia, who's gonna share more about local community organizations and the work they're doing to address some of the issues I discussed.
Thank you, Nancy. Hello again. Once again, my name is Cynthia. I use she, her pronouns. And as I mentioned before, I recently graduated from Oregon State University, so I was very excited and nervous entering the job force in a pandemic, and was very lucky to join the team of Casa Latinos Unidos as a community health worker. Community health workers are integral in connecting the community to health systems and social programs. We are outreach workers, educators, and most of all, relationship builders to co-create plans with people based on their needs. So today I'll be sharing about Casa Latinos Unidos and the work that I'm doing in Linn County, Oregon. And a little bit about ourselves. Our vision is be the leading organization in Benton and Linn counties, working towards strengthening the Latino community through collaboration and action. Our mission is building our community together. A brief history about Casa Latinos Unidos. We became a 501c3 nonprofit organization in 2009, starting with a team of 2 people, a director and an intern at the Sunflower House in Corvallis, Oregon. If you all remember the Sunflower House, it is no longer there. As of 2017, we are now located in the Western View Center of the Corvallis School District's Welcome Center, forming a partnership to better assist student families in the area. Since 2009, our team has expanded to include a client services coordinator, an administrative assistant, a community liaison, a community health worker, and an executive director. Although we started serving Benton County, we expanded to Linn County in 2018 and are now serving the counties in 3 main programmatic areas: basic needs, civic engagement and advocacy, and community and cultural engagement. And we are the only culturally specific organization in the area who serve Latinx, Indigenous, and people of color who identify from a region of Latin America. So like most nonprofit organizations, Casa Latinos Unidos responds to what is in need of the community. In 2020, that need is around relief and support around the COVID-19 and how it has affected so many households. Since March in the summer, the Casa Latinos Unidos team was busy every day answering calls and trying to get everyone help. We were also busy trying to find means to keep this help ongoing. We ended up providing financial, We ended up providing financial assistance from March till July, totaling up to $50,000. But most of the families we were helping didn't qualify for government aid programs, such as stimulus checks or other related aid. So fortunately, in June 2020, help did arrive. The Oregon Health Authority, OHA, released a grant announcement for community-based organizations to support culturally and linguistically responsive services as part of the state's COVID-19 response. These grant funds are directed to communities that include, but are not limited to, people of color, people with disabilities, people who are houseless, individuals with substance use disorder, immigrant and refugee communities, faith communities, undocumented communities, and farm workers, people experiencing mental health issues, older adults, and LGBTQIA+ communities. Thus, after applying for this grant, Casa Latinos Unidos became one of the community-based organizations who are now a grantee. Next slide. Thank you. This collaboration with Oregon Health Authority means that community-based organizations are being funded to do specific buckets of work, such as education, contact tracing, and wraparound support. So I thank Oregon Health Authority for the position I am now, since it was through this funding that Casa Latinos Unidos was able to create a new role, a community health worker, to be part of their team to help address the variety of problems Latinx households were experiencing under the pandemic. So thank you, OHA, I have a job now. With this grant, I'm operating under Casa Latinos Unidos Basic Needs Program, providing education around COVID-19, making sure that information and strategies that I provide around prevention and wellness in the time of COVID are relevant and specific to our community. In addition, we are providing help with wraparound support to ensure that people who have been exposed to the virus or who have tested positive for COVID-19 are receiving the assistance they need. And we do this by helping them enroll into safety net programs like Oregon Health Plan or SNAP, or assisting with costs associated with isolation and quarantine, and overall figuring out a plan so that people are able to receive what they need so that they can isolate and recover. So as Casa Latinos Unidos community health worker serving in Lynn County specifically, I'm also cognizant about the area I'm helping our clients in. Lynn County reflects much of what the majority of Oregon looks like. It's rural, it's predominantly white, it's predominantly conservative. Growing up in my hometown of Albany, which is part of Lynn County, I had very few spaces where I felt like I was taken seriously and that my family, a working class Mexican immigrant family, was taken seriously. And growing up in this way creates a lot of internalization of not being enough or feeling like you have to hide who you are, which is very lonely. In a pandemic, this loneliness is exacerbated and felt especially on collectivist populations, including Latinx people. Being left on the margins, people find a way to survive by helping out one another, relying on family and group work. Low-income Latinx mothers and women-identifying individuals are often the ones creating bridges for their households to find security, support, and care. COVID impacting many groups left out of government aid or protections means that gathering in these ways is dangerous. However, not being able to see one another or help one another leaves gaps in their daily lives, for example, like transportation, childcare, self-employed occupations, and even access to resources, which are often discussed through in-person word of mouth. Although the community is adapting, this means having to overcome multiple barriers all at once. So being able to give back to my hometown and the communities in these areas is very rewarding and also very eye-opening of the systems in place which so rigidly leave people out. Building trust with community members means that when a person comes to us for help, we acknowledge the unique circumstances surrounding the situation, that we build partnerships with other organizations to create space for Latinx people to feel comfortable using them, and that we respond to what the community is in most need of. And as we understand that in Oregon, Latinx people only represent a smaller percentage of the population, but are heavily impacted due to the socioeconomic factors with COVID, such as being frontline workers, like farm workers, those who bring food to our tables, the cleaning industry, those who are exposing themselves to the virus, cleaning operating buildings, and holding jobs which are greatly needed but involve vigorous physical labor. Or also people who have been affected by the layoffs, the business closures, all those things, and not receiving government help due to legal status, misinformation, or intimidation. With all this in mind, our response at Casa Latinos Unidos has been highly collaborative. Our OHA grant allowed us to do more for the community, from immediate assistance to even work with them and local public health authorities to organize free COVID testing events. Thus far, our first COVID testing event happened last weekend, which was a great success. I was very worried. I was like, I'm not sure how it's going to go, but we tested about 553 people, 223 in Albany and 309 in Corvallis. And for these events, we also partnered up with organizations to have resource information stations so that people who drove through on their way to their COVID test could receive outreach materials. We were also offering a meal to go. So once participants finished their COVID test, they could receive a meal to go to create that warm and supportive experience for the community. So this is me at the event on Saturday, and that's one of our flyers. So I'm sure everyone is hearing the phrase cracks in these systems and pandemic together, because COVID-19 has really emphasized what the system is built to protect, and it's often not human lives. And even more so people who are already left out and who are an afterthought. And so truly the pandemic has widened these gaps and the people most vulnerable right now. In my time working with Casa, Latinos, Unidos, I've noticed that these groups are the most vulnerable at the moment: single parents, undocumented mixed status families, migrant seasonal farm workers, childcare providers, adolescent youth, survivors of domestic violence, LGBTQ plus people, and neurodivergent individuals. And I'll be sharing a little bit more, a little bit about the topics that the work I'm doing. I think 80% around, I do a lot of my work through calls, so I'm very virtual in that way. And I'll say that 80% around of my calls I receive are around housing, either through rent assistance applications, through our partnership with Community Service Consortium, or people who are relocating, need help finding low-income housing. If they don't qualify for programs available out there, Casa Latinos Unidos helps them with their rent through our emergency fund. However, this funding is so limited because it is based on donations. So during these calls, I often find myself sharing information about the eviction moratorium, which was set to expire in September 30th, but has been extended once again to the end of the year, December 31st. And although this gives people and families in these situations time, they still fear having to find the means to pay for this rent since they lost their savings, jobs, are dealing with so many challenges for up to months now. I know families right now who haven't been working since March and are making do with a very tight budget to stay afloat while they look for employment. Something else I would like to highlight is the emergency response. During the weeks of September 5th, September 8th, in the time of the Oregon wildfires, parts of Lynn County remained under evacuation, and the aftermath revealed that 54 homes were burned, with smoke levels staying hazardous for days on end. I was on the phone with clients every day, simultaneously monitoring the evacuation levels and the smoke hazard levels in the areas closest to us. And I still had clients who were worried about paying their rent on time. Despite this stressful environment, bills and their due dates don't stop. Earlier in the wildfire weeks, I recommended to a client that we would mail her check for her emergency assistance so that she wouldn't have to pick it up because the smoke levels were really hazardous. However, she was able to find a ride. She doesn't drive with her neighbor, and she went to our office despite the concerns I mentioned, the smoke levels and traffic congestion due to people evacuating. And during this time, I had another client who was being threatened with eviction, and she was worried about being out in the streets with her daughter who has asthma. So imagine the stress of being harassed about past due rent with dangerous smoke levels. And it was so disheartening to hear, honestly. So we were able to help her, but it was a very stressful and so many things that she was worried about and that I was trying to address with her at the moment. And then lastly, when I went to check out the evacuation center in Lynn County in Albany, I was hoping to see how the experience was like for Spanish-speaking and Latinx evacuees. I gathered that the center didn't have any translation assistance, which meant that maybe maybe it wasn't needed. Or maybe that Spanish-speaking individuals, which are often Latinx people, weren't receiving the help that they perhaps needed. And they mentioned they didn't have that need there, but it just highlights a gap in emergency response in local, state, and national realms. So in these very uncertain times, when systems fail, it is through the community that sustainability and resilience occur. We cannot do things alone. We need each other to amplify, assist, and work with. With COVID-19, isolation is very prevalent, but that doesn't mean connection isn't possible. If we're going to be doing this together, we can lend our skills, our time, and energy, financial means to help.
Thank you so much, Cynthia and Nancy. I really appreciate and I'm grateful for the opportunity to work with the both of you on this important work. The two things that I got the most were the importance of working together and knowing that we are not alone in this experience. And so here are a few things that you can do. First one is that Latinx parents of youth 13 years plus in the 9th to 12th grade are invited to participate in our program, in our workshops to train youth as allies. You can contact me at my email listed here, jonathan.garcia@oregonstate.edu. If you are a language speaker, si habla español, puede escuchar este podcast, una conversación conmigo y Familias en Acción sobre nuestro trabajo. Se llama Hablar del aislamiento social y de la salud sexual es amar al prójimo. And you can also read the paper that was referenced earlier in our presentation. And probably most importantly, you can donate or volunteer at some of these frontline organizations, such as Casa, Latinos, Unidos, outside the frame, or Familias en Acción.
Oh my goodness. Thank you so much, Jonathan, Nancy, Cynthia. What an enlightening and moving discussion on what you all are doing and how all of us can know better and do better, to quote our dear poet and professor Maya Angelou. We're so thankful to all of you for this. Goodness, how about we all, we have your videos are on. I'm so glad. Okay, I wanted, as we thank our audience today, I wanted them to be able to see you as we close out. At the risk of going a touch long, I want to encourage everyone. Jonathan, you've given us some wonderful to-do items on consider giving of your energy or of your financial contribution. It sounds like 4-H outreach volunteering is a wonderful place for people in the audience. I love the nodding. Yes, to give of their time. I also, you all talked about, I think it was Nancy, you talked about moving from sort of compassion as an ally to really getting your feet muddy as in solidarity as an ally. And I thank you for that. And another key point that I think really struck me in the beginning was about how social isolation is not like a moral failing, right? It's not an individual failing of one human, but rather our community. And I would say same thing with these systems, right? No one single one of us put the whole mess together, but it's up to all of us, every single one of us, to undo these systems. And we're so glad we can talk about them today. I would encourage the audience to get in touch with Jonathan, get in touch with Casey Farm at the Alumni Association for any follow-up. And Casey, I think it's time for you to close us out.
Thanks, Allison, and Jonathan, Cynthia, Nancy. Thank you very much for your discussion today. It was absolutely incredible. I really appreciate the work that you're doing on behalf of the college and of Oregon State University and of all of us in our various communities. So thank you very much. Really appreciate it. And thank you to our audience out there for participating today, for watching today's webcast. We love having you here for the Public Health Insider, and we look forward to hosting you again as our next one, which will be the last one of this second season. Will be again 2 weeks from today on Thursday, November 12th at 1 p.m., where our next set of panelists will discuss how environmental health in the home can affect child development. So you don't want to miss that. And you can register for that upcoming webcast, as well as watch this talk and previous talks from the Public Health Insider series at osualum.com/public health webcasts. I also invite you to visit the OSU Alumni Association's website to find out how you can send encouraging words and advice to current students. It's a fun and easy way to give back and to volunteer through the You've Got This initiative. It's very quick and simple, like I said, and it makes a huge difference in the student's life as these messages and words of encouragement will be delivered during finals week, which if you're any kind of alum, no matter where you're at, you know that's a really pressured-packed time. So again, visit the OSU Alumni's website at osualum.com and look for the You've Got This initiative. Until then, we look forward to hosting you in a couple of weeks, and stay safe and enjoy the rest of your day. Thank you very much. Take care.